Okay, so everyone should know that we are recording this session. I am Judy Lewis. I am the board chair of Women in Health Together for the Future. And we're very happy to be doing this session on eliminating unsafe abortion today when it's being celebrated and examined around the world. So I will not take much time except to tell you that Women in Health Together for the Future is an organization mostly of the Global South. And it's about sharing experiences in all of our work on women's health and advocating for women's health issues. So we represent 22 countries around the world, and I would like to invite everyone who is not a member to become a member. So welcome to this session. I also would like to tell you that we have a learning package. Oh, I don't think this works very well. We have a learning package document on unwanted pregnancy and unsafe abortion, which Dania is the lead author on. And so that's also something available as a resource to everyone. So I look forward to hearing everyone's thoughts and experiences and learning what's going on in your countries. And I'm going to turn this over to Kamini Bali Mahabal, who is going to moderate the session. Kamini.
Thank you, Judy. Thank you, everybody, and welcome whoever has joined us here. And as today you see, it's 28th September each year. It's commemorated as the International Safe Abortion Day. And this year, our theme is making unsafe abortion history. So as we know, due to unsafe abortion, we are losing a lot of lives, especially maternal mortality has increased a lot. Judy, can you mute Mitra? Yeah. So the issue is that looking at abortion as a human right and saying that abortion is also healthcare, it is very much important. And I think this is one contentious issue which has even divided the women's rights movement and human rights movement on at what level do we accept the abortion to be there. Is it a total right of women or not? There are debates and discourse. In fact, this year also, the WHO has asked that, a safe medical abortion, sort of a training by women to do it themselves. I mean, whether it's okay or not, these debates are going on. And especially in India, I would like to say in India, it is a very problematic issue because we do have a Medical Termination of Pregnancy Act, which clearly gives a woman a right to abortion under certain conditions. But still, medical professional, our first speaker, Dr. Veena, is going to share that still the speakers have that sort of own bias, values, and discrimination, and in fact, do not give access to women abortion until unless they have a family member. So the whole issue of my body and my right, is it still there? We would like to start our webinar today with an award-winning short film, which has been co-written and produced by Dr. Veena, who is an activist and a forensic science expert from Kerala. And I must say that she has been so vocal on social media, especially on the issue of reproductive rights and also on the issue of gender, breaking the gender stereotypes. She also has a show called Gender Talks, which is in Malayalam. Veena, I hope you get subtitles in English so everybody, and I am quite sure that it is an amazing show. So breaking the stereotypes online, she has been on social media all over, and she has been also commemorated by Indian Medical Association for voicing her opinion. So I just want you all to give you a trigger warning that this movie has some violence. So I'm preparing you for that. We will have a discussion with Dr. Veena about the film. So I'm requesting Judy to please start the film called Owl. It has won 10 awards in Tagore International Film Festival. And it was done last year. And I don't know, this gem of a jewel of a film is still not seen by many people, and I hope that this film would be used. I would be using it as a training tool in various of my training sessions. I feel very strongly about this film, and I hope you will as well. Judy, you're sharing the sound, right?
മോനെ മോനെ ഒന്ന് വേഗം പോടാ, ഒന്ന് വേഗം പോടാ എന്റെ കുഞ്ഞ്.
തന്നോട് എത്ര വട്ടം പറഞ്ഞിട്ടുണ്ട് ജീൻസ് ഇട്ട് വരരുതെന്ന്? എന്താ തന്റെ വിചാരം? താനങ്ങ് അമേരിക്കയിലാന്ന? ഇത് ഭാരതാണ്, നമുക്കൊരു സംസ്കാരമുണ്ട്, അത് മറക്കണ്ട കേട്ടോ.
മാം,
എന്തത്ര വൈകിയ?
സുമേഷ് സാറിനെ കാണാനായിട്ട്.
എന്നാ പിന്നെ സുമേഷ് സാറിനെ കണ്ട് അവിടെ തന്നെ ഇരുന്നാ പോരെ, എന്തിനാ ഇങ്ങോട്ട് വന്നേ? തോമസ് വന്നില്ലേ?
ഇല്ല മാം,
എന്താ നിന്റെ പ്രശ്നം?
എനിക്ക് അബോർഷൻ വേണം.
എന്താ എന്താ നീ പറഞ്ഞേ?
എനിക്ക് അബോർഷൻ വേണം ഡോക്ടർ.
കൊച്ചു കരയണത് കണ്ടുകൊണ്ടേടി. പോട്ടെ പോട്ടെ പോട്ടെ, വാ 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 പോട്ടെ, കരയണ്ട. നീ തന്നെ പറ്റല്ലേ ഇതിന്? പോട്ടെ പോട്ടെ മോകരല്ലേ.
എന്റെ തമ്പുരാനെ, നീ എന്തീ പറയണേ? നിനക്കിപ്പോ എത്ര മാസായി?
3.
3 മാസോ? നിനക്കിതെങ്ങനെ പറയാൻ പറ്റണേ? ഇങ്ങനെ കണ്ണീ ചോരയില്ലാണ്ടാവോ? ദൈവം പൊറുക്കില്ല മോളെ. ഇവിടെ എത്ര പേരാന്നറിയോ കുട്ടികളില്ലാണ്ട് ചികിത്സയ്ക്ക് വരണത്? ദിവസം എത്ര കേസുകളാ. നിനക്ക് ദൈവം നിന്നെ തന്നപ്പോ വേണ്ടാന്ന് വെക്കുക, ഈ കുട്ടിശാപം മോളെ വിട്ടു പോവും. മോള് ചെല്ല്, മര്യാദക്ക് ഈ കുട്ടിയെ വളർത്താൻ നോക്ക്.
എനിക്ക് ഈ കുട്ടിയെ വളർത്താൻ പറ്റൂല ഡോക്ടറെ. എനിക്ക് വേണ്ട.
നിനക്ക് ഈ പറയണതൊന്നും മനസ്സിലാവണില്ലേ? ഇപ്പൊ തന്നെ 3 മാസമായി. 3 മാസം കഴിഞ്ഞ് ഇവിടെ ചെയ്യില്ല. ഇവിടെ നിന്നല്ല എവിടെയും ചെയ്യില്ല. ഈ ഒരു അബോർഷൻ കഴിഞ്ഞാല് പിന്നെ ഒരു കുട്ടി ഉണ്ടാവുന്ന ഉറപ്പുമില്ല. നീ സമാധാനായി പോയിരുന്ന ആലോചിക്ക്. ചെല്ല്.
ഞാൻ നന്നായിട്ട് ആലോചിച്ചെടുത്ത തീരുമാനം ഡോക്ടറെ. എനിക്ക് വേണ്ട.
അല്ല, ആ കുട്ടിക്ക് അബോർഷൻ വേണമെന്ന് പറയുമ്പോൾ അത് ചെയ്തു കൊടുക്കാലോ മാം. 3 മാസമല്ലേ ആയിട്ടുള്ളൂ.
നീ നിന്റെ പണി ചെയ്താ മതി, എന്നെ പഠിപ്പിക്കാൻ വരണ്ട. ഇവിടെ അത് ചെയ്യില്ല. റീന ചെല്ല്.
എങ്കിലും ആ ചീട്ടിലൊന്ന് എഴുതി തന്നേക്ക് ഡോക്ടറെ. ചെയ്യാൻ പറ്റാത്തതിന്റെ കാരണം എന്താണെന്ന്.
മോളുടെ കൂടെ ആരും വന്നില്ലേ? പറഞ്ഞ മനസ്സിലാവുന്ന ആരെങ്കിലും?
കൊച്ചിന് ഇത്തിരി പാല് കൊടുത്ത്. ഇത്തിരി പാല് കൊടുക്കാൻ. നീ ഇത് എന്ത് ഭാവിച്ചാണ്? ഇതിനിത്തിരി പാല് കൊടുക്കാൻ. ഇതിന്റെ ഉള്ളിൽ ഇത്തിരി മുലപ്പാലിട്ടെ. എത്ര നാളായി ഈ പൊടി ഇലക്കി കൊടുക്കാൻ തുടങ്ങിയിട്ട്? ഞാനും 3 പെറ്റതാണ്. ഇങ്ങനെയുണ്ട് ഒരു അഹങ്കാരം, ഇങ്ങനെയുണ്ട് ഒരു പെണ്ണുങ്ങളും. പോട്ടെ മോൻ പോട്ടെ. ഓ പോട്ടെ, നമ്മുടെ മോൻ പോട്ടെ. മോനെ ദാ ഒന്നിങ്ങോട്ട് വാടാ. ഇവളിവിടെ മിണ്ടണമില്ല, പറയണമില്ല. ഈ കൊച്ചിന്റെ കാര്യം ഒന്ന് നോക്ക്, ഒന്ന് കൈമാറണ്ടേ? വീട്ടിലെ പണി എടുക്കണ്ട, അത് പിന്നെ ഞാൻ എങ്ങനെയെങ്കിലും എടുത്തോളാം. ഈ കൊച്ചിന്റെ കാര്യം നോക്കണ്ടേ? അല്ലെങ്കിൽ അവളുടെ കാര്യം ഒന്നും നോക്കണ്ടേ? ഇതൊന്നും ചെയ്യണില്ല. നീ ഒന്നിങ്ങോട്ട് വാടാ. ഞാൻ എത്ര ദിവസം ഇടാന്ന് തുടങ്ങിയിട്ട്. ആ ആ ശരി ശരി.
മോളുടെ ഭർത്താവ് എന്തേ?
ഇവിടെ ഇല്ല, പുറത്താണ്.
നാട്ടിലില്ല?
ഇല്ല.
ആ, എന്നാ പിന്നെ ഇത് നടക്കില്ല. ഭർത്താവിന്റെ ഒപ്പവും സമ്മതമില്ലാതെ അത് ചെയ്യാൻ പറ്റില്ല.
ഹസ്ബൻഡിന്റെ കൺസെന്റ് ഒപ്പില്ലെങ്കിലും നടക്കും ഡോക്ടറെ. എന്റെ അനുവാദം മാത്രം മതി, അല്ലേ?
അതൊക്കെ പറയാൻ കൊള്ളാം. നീ ഒറ്റയ്ക്ക് ഉണ്ടാക്കിയതൊന്നല്ലല്ലോ. നിന്റെ വയറ്റിൽ കിടക്കുന്നതിനെ നിന്റെ കെട്ടിയോനും തുല്യ അവകാശമുണ്ട്.
എന്റെ വയറ്റിൽ വളരണോ വേണ്ടയോ എന്ന് തീരുമാനിക്കാനുള്ള പൂർണ്ണ അവകാശം എനിക്ക് മാത്രമാണ് ഡോക്ടറെ. നിയമം അതിന് അനുവദിക്കുന്നുണ്ട്.
ആഹാ, നിയമൊക്കെ പഠിച്ചിട്ടുള്ള വരവാണല്ലേ? ആദ്യം നിനക്കൊരു കൗൺസിലിംഗ് തരാം, എന്നിട്ട് ആലോചിക്കാം. നീ അയാളോട് വരാൻ പറ.
ഇല്ല.
വീട്ടുകാരും നാട്ടുകാരും അറിയാതെയുള്ള വരവാണല്ലേ? അല്ലെങ്കിലും കുടുംബത്തിൽ പറഞ്ഞവരോ നീ പണിക്ക് നിൽക്കില്ല.
ഹലോ.
ഞാൻ നിന്നോട് പറഞ്ഞിട്ടില്ല എപ്പോഴെപ്പോഴും വിളിച്ച് ശല്യപ്പെടുത്തരുതെന്ന്. എന്തിനാ എപ്പോഴെപ്പോഴും വിളിച്ചോണ്ടിരിക്കണത്?
ഹലോ ഏട്ടാ, ഞാനൊരു അത്യാവശ്യ കാര്യം പറയാൻ വേണ്ടി വിളിച്ചത്.
എന്ത് അത്യാവശ്യം? എന്റെ സൗകര്യം കൂടെ നോക്കണ്ടേ?
സോറി ഏട്ടാ, ഫ്രീ ആകുമ്പോൾ വിളിച്ചേച്ചാൽ മതി.
നീ എന്താന്ന് വെച്ചാ പറഞ്ഞ് തൊലക്ക് നീ.
ഏട്ടാ, ഞാൻ പ്രഗ്നന്റ് ആണ്.
എന്താ?
അതെ ഏട്ടാ, ഞാൻ പ്രഗ്നന്റ് ആണ്.
നീ എന്താടി പറയണത്? നീലടി വേണ്ട വേണ്ടെന്ന് പറഞ്ഞ് തൊടിക്കാതെ കൊണ്ടുകിടന്ന് അകത്താകണ്ടെന്ന് പറഞ്ഞ് പുറത്തും കളയിച്ച് ഇപ്പൊ നീ പ്രഗ്നന്റ് ആണെന്നാ? നിന്റെ ഡേറ്റ് കൂടി നോക്കിയിട്ടില്ലടി ചെയ്തത്? പിന്നെ നിനക്ക് മാത്രം ദിവ്യകർമ്മം വന്നാ?
എന്തൊക്കെ ഈ പറയണേ?
ഇനിത് എന്റെ കുട്ടിയാണെന്ന് പറഞ്ഞ് ഞാൻ വിശ്വസിക്കണോ? പറയടി, ആരടി ഇതിന്റെ പറ്റവൻ? ജോലിയുള്ളതിനെ കെട്ടരുതെന്ന് എല്ലാവരും എന്നോട് പറഞ്ഞതാ. എവിടെയൊക്കെടി കറങ്ങി നടന്നിരുന്നത്? എന്താടി മിണ്ടാത്തത്? ഹലോ ഹലോ ഹലോ.
ഭർത്താവ് അങ്ങനെ പറഞ്ഞു എന്നുള്ളതുകൊണ്ട് അപ്പൊ തന്നെ കുട്ടിയെ വേണ്ടാന്ന് വെക്കല്ലേ? ഇതൊക്കെ ഒരു റീസൺ ആണോ? നിനക്കൊരു സ്ട്രോങ് റീസൺ പോലും പറയാനില്ലേ? ഇനിയിപ്പ അയാള് സംശയിക്കുന്നത് പോലെ വേറെ ആരുടെയും കൊച്ചാണോടി?
കഴിക്ക് കഴിക്ക്.
എന്റെ റീനെ മരുന്നൊന്നും എടുത്തരാൻ പറ്റില്ല. കഴിഞ്ഞ ആഴ്ച ഒരു ചോര
ഇവിടെ ചെയ്യും, ബട്ട് വളരെ പെയിൻഫുൾ ആയിരിക്കും. അനസ്തേഷ്യ ഒന്നും ഉണ്ടാവില്ല.
ബെസ്റ്റ് PCOD ആണെങ്കിൽ പോലും വേഗം കല്യാണം കഴിക്കും കുട്ടികളുണ്ടാക്കുന്നെന്ന് പറയുന്ന തള്ളെടുത്താണോ നീ പോയത്?
അബോർഷൻ കഴിഞ്ഞാൽ ഒരാഴ്ചത്തെ റെസ്റ്റ് വേണം. നമ്മുടെ ഹോസ്പിറ്റലിൽ എല്ലാ സൗകര്യങ്ങളും ഉണ്ട്. പേടിക്കാൻ ഒന്നുമില്ല. 40,000 രൂപയേ ഉള്ളൂ.
പള്ളി ക്ലാസ്സിൽ പറയുന്നതൊക്കെ പുള്ളോ, നീ അതൊന്നും നോക്കിയിട്ട് കാര്യമില്ല.
ഒരു സൈക്യാട്രിസ്റ്റിന്റെ അടുത്ത് നിന്ന് താൻ മെന്റലി ഓക്കെ ആണെന്ന് സർട്ടിഫിക്കറ്റ് ഉണ്ടെങ്കിൽ മാത്രമേ കാര്യം നടക്കൂ.
മോളെ, മോക്ക് എന്താ പറ്റി?
അറിയില്ല. എനിക്ക് വെറുപ്പാണ് നിങ്ങളോട്. എല്ലാവരോടും വെറുപ്പാണ്.
ആ ശരി.
കാറാതെ കിടക്ക് കൊച്ചേ, എന്താ വിചാരിച്ചേ? കിടന്നു കിടക്കുമ്പോൾ ആലോചിക്കണം. ഇത് വലിയ സുഖമുള്ള ഏർപ്പാടൊന്നുമല്ല, മനസ്സിലായില്ല? ഒന്ന് ശരിക്കും മുക്ക് കൊച്ചേ, അല്ലെങ്കിൽ അകത്ത് കിടക്കുന്ന കൊച്ച് ശ്വാസം കൂടി ചത്തുപോകും. അടങ്ങി കിടക്ക് കൊച്ചേ, മുക്ക്. മുക്കല്ല, ഇതൊക്കെ അകത്ത് വെച്ച് കൊടുക്കുമ്പോൾ ആലോചിക്കണം അങ്ങനെയൊക്കെ ഉണ്ടാവുന്നു.
മോളെ, മോക്ക് എന്താ പറ്റി? അമ്മ എന്തെങ്കിലും തെറ്റ് ചെയ്തിട്ടാണോ? മോളോട് അമ്മ എന്തെങ്കിലുമൊക്കെ പറയണത് നിന്നോടുള്ള ഇഷ്ടം കൊണ്ടല്ലേ? ഇനി അഥവാ അമ്മ എന്തെങ്കിലും പറഞ്ഞിട്ടുണ്ടെങ്കിൽ എൻ്റെ മോളങ്ങ് ക്ഷമിക്ക്. നീ ഇങ്ങനെ ഇരിക്കല്ലേ, ഇത് കാണാനുള്ള ശക്തി എനിക്കില്ല.
അയ്യോ, തല പെരുക്കുന്നു. എങ്ങനെയുണ്ടോ ഒരു കൊച്ച്? ഒന്ന് പതുക്കെ കരഞ്ഞു. മനുഷ്യന് തല പെരുത്തിട്ട് വരില്ല. ഇതൊക്കെ അറിയാഞ്ഞിട്ടാണോ പേറാമെന്ന്? ഒന്ന് പതുക്കെ കരയും കൊച്ച്. ഇതാ പറഞ്ഞേക്കാം, ഇനി ഒരു 4 വർഷം കഴിയാതെ ഇനി വന്നേക്കരുത്.
കുട്ടിയെ വേണോ വേണ്ടേന്ന് വെക്കാനുള്ള പൂർണ്ണ അവകാശം എനിക്കുണ്ട്. 3 മാസമല്ല, 20 ആഴ്ച വരെ കുട്ടിയെ വേണ്ടാന്ന് വെക്കാനുള്ള നിയമം ഇവിടെ ഉണ്ടെന്ന് എല്ലാവർക്കും അറിയാം. മൈ ബോഡി ഈസ് മൈ റൈറ്റ്.
അവകാശങ്ങളെ പറ്റിയൊക്കെ നല്ല ധാരണയുണ്ടല്ലേ? അല്ലെങ്കിലും കുറച്ച് എഡ്യൂക്കേറ്റഡ് ആയിട്ടുള്ളവരെ ഇതൊക്കെ മിസ്യൂസ് ചെയ്യൂ. നിനക്ക് ഇവിടെ നിന്ന് അബോർഷൻ ഇല്ല. നിനക്ക് എവിടെ നിന്നും അത് കിട്ടുകയുമില്ല, ഞാൻ സമ്മതിക്കുകയുമില്ല. My profession is my choice.
മുക്ക് മുക്കങ്ങ്
ആക്ച്വലി ഞങ്ങളതൊട്ടും പ്രതീക്ഷിച്ചല്ല ഡോക്ടർ, ഞങ്ങളൊട്ടും പ്രിപ്പയർഡ് അല്ല. സോ ഇതിപ്പോൾ വേണ്ടാന്നുണ്ട്.
നിങ്ങൾക്കിത് ഹറാമല്ലേ?
After this hard-hitting movie, I would request Dr. Veena to talk about the making and her experiences about this.
Hi, thank you so much for presenting the movie to all here. Am I audible? Can you hear me?
Yeah, you're audible.
First of all, sorry for the trigger element in this movie, but this is total reality which we have shown. As a medical practitioner and as a medical student also, I frequently and even now I receive calls from almost all the females who approach for abortion but denied by medical practitioners in Kerala especially. And this has increased during COVID situation, and most of the females are forced to deliver the kids. And we have decided to take this movie by supported evidence of certain studies, sufficient amount of studies, which brings out the facts that post-childbirth psychosis or mental stress issues are very much present in females, women, especially when they are denied of abortion services, when the pregnancy is unwanted, totally unwanted. And this is too much increased in compared to women who deliver their own out of their own will. So we have decided this, and as a forensic medicine expert, I have seen many women killing their own babies all over the India, or maybe this can be compared to all over the world, women killing their own children out of this psychosis issue. So compared to England and all, where they have a separate law for women who has to do this out of the psychotic issues, they deal them with manslaughter, not like in India where this culpable homicide issue, that is with intent. Our law consider women who kill their children during this 1 year postpartum as they decide to kill and they have an intent to kill. But this is totally wrong because there is an entity called postpartum psychosis, and I wish law rethinks about this. And media also use very harsh language against the women who do this. And almost all the events are from reality, from their marriage through their relationships. That is, you must have seen the domestic violence he is showing. Like they don't have, she doesn't have any sexual autonomy. That is very reality, even in the educated community of Kerala. Sexual autonomy includes decide to marry, whether to marry, whom to marry, and whether to have children, and which method of contraception to use. And in this, this church, that is Christianity, plays a crucial role to make the women away from all this sexual autonomy. Recently, Kerala government's Women and Child Department has told that women should be given abortion by the medical practitioner, just because they have got too much complaints from women saying that medical practitioner abuse women when they approach for this abortion services, even when we have a law that is dates back to 1970, and even now it happens. So when government has to announce it, too much persons, including Christianity people, that is Christian Congress, came to and protest against government stand. That is against the law they were protesting. They were even unaware, or they were acting like they are not aware. And in their premarital counseling sessions, they are telling like property induces the already formed fetus to abort. So such unscientific education happens all over here. And they ask the couple to have withdrawal method. So this is, we can't even believe this. This is 2021 and still they are doing this. And doctors don't do ethical practice for women. And today one woman even messaged me, if at all that lady doctor, that gynecologist was women friendly, I would have completed my research. I had to give birth to child. She was saying I could not use copperty. See, all over the world, even the women who did not give birth to child using copperty for their before their first pregnancy. But in India, it's still unscientific, and they deny women, and they even consider husband and family's consent for all of this. So I wish everyone protest against this, because we have still a law that is just, I mean, it's a wonder that we have a law, but still they are ridiculing it.
Exactly, yeah,
So
yeah, Dr. Veena. I mean, this whole cycle of violence, I mean, if we see within our patriarchal society, which is there everywhere, the cycle of violence actually begins with the birth of the girl child, and how unwanted she is at the, at the level of the sex selection. As you know, in India, we also have the PCPNDT Act and Sex Selection Act as well. And you see how the dwindled child sex ratio is. So this whole cycle of violence actually continues because the woman does not have the right over her own body. I would like to just take another, say, around 5 minutes, 5 to 10 minutes, if people have any particular questions regarding this film, and to Dr. Veena. Anybody would like to ask anything to her about the film?
May I make a comment? I don't have a
Sure, sure.
question. I'm Dr. Mitra Saxena.
Sure, Dr.
And
Yeah.
I must congratulate your team, and I have regards for my dear friend who is the vice chair, Dr. Surekha Taide, who invited me to join this screening, and I'm really glad that I had the courage to watch this movie. It's a stark reality that women are denied abortion rights according to the practices. Well, in North, we don't have that type of a persona, but yes, sometimes the violence is not so much physical as it is, these words that are used. Those very, very hurtful phrases and words which healthcare personnel do utter in whatever it is bad grooming or bad conduct, that the nurses or the doctors can be very rough when they are dealing with patients of abortion. So I think the movie is it's a hard hitting one. It's very sad that religion interferes with state and the personal freedom of a person, which is, really, which should not be acceptable in a civilized world. But yes, that is the reality. What is in word is not actually followed in spirit. But it's very, very important that all us, at least gynecologists, we should be very conscious of what we are speaking, because we really don't know under what circumstances that woman has conceived that baby. Not all babies are conceived out of love and, want.
Yes, I totally agree, Dr. Mitra, with you. And basically the issue of mental violence, when we say something which we cannot see, and how doctors discriminate. In fact, I just wanted to add that here we are talking about of abortion, but the disabled women, the doctors chide and remark when a disabled woman goes for access of contraception, or when a disabled woman would say that she wants to have a child, then doctor would say, how can you have a child? You don't even have a limb, right? So it's the other way around how we see the discrimination, and even for the sex workers, I mean, people who are going. So such discriminations do come up. Dr. Surekha, would you like to say anything?
Yeah, thank you, Kamayani and Dr. Veena and Judy for the screening and this dialogue which we are having on safe abortion access today on World International Safe Abortion Day. The movie itself is really strong, the way it has been made. And as Dr. Veena has said, it is based on reality. And I see quite a few issues from the lot of messages have been given from the movie, and few issues I can see. One is the denial of abortion right, which is a reproductive right, and already Government of India has passed the law 1971 itself, and in 2021 there has been an amendment to the law also, wherein the safe abortion services can be accessed till 24 weeks of gestation. So initially it was till 20 weeks, and we have a law which has been passed wherein it could now be accessed till 24 weeks of gestation. There are certain indications which have been specified under the law wherein the lady can seek the abortion, right? But this lady has been denied that reproductive right. And of course, we can see a lot of abusive language has been used. And as Dr. Veena says, it is based on reality. And I also see another problem there in this movie, that is about respectful maternity care. When she's being delivered and she's having the childbirth, at that time also a lot of abusive language is being used, and that is what is making that particular one disorder which we say tocophobia. She has the phobia of vaginal delivery, she has the phobia of childbirth, and that is what, it is very strongly shown. And of course, the respectful maternity care which is not being given to her, and the wild, of course, another thing which has been shown, but maybe it is sort of a hidden agenda here in the movie to show that even the pain, the analgesia which should be provided during labor, that also is lacking in a lot of, we have so many public hospitals with large volume deliveries occurring, and the type of care which is being given with no labor analgesia. So all these things are together. I could find a mix in the movie, and basically the psychology of the woman is so much affected. And yes, as Dr. Veena said, the violence against the child which has been committed is because she has undergone so much and she has been denied, and that's why, and rightfully we are here now to discuss how these challenges can be, how we can overcome the barriers, and what could be the possible solutions. Mexico now has made abortions legal, but still, even if the legal access is the judiciary has provided this right, still maybe the religious and personal biases of the healthcare provider. That's all about. It's not all the healthcare providers are doing it, but there are quite a few, and specifically about the cost of an abortion, like 40,000 rupees, which was asked. The husband being asked to be the psychiatry certificate. So many things has been brought in by Dr. Veena, and thank you for bringing that. And definitely we need to think a lot about this and come up with some, I don't know how we can, cross the barriers, but we need to start thinking at least, and we need to start educating at least amongst the women and healthcare workers.
Thanks, Dr. Surekha. Dr. Veena, one last question I would like to ask you. How do you stand within the medical fraternity? I mean, it's like a constructive criticism when we all feel, but anytime the medical fraternity is so strong, especially for PCPNDT Act. So now since MTP Act is so strong, they are not even, actually giving abortion services because of the PCPNDT Act, which says that sex is sex selection. So the abortion services are not. So how are you placed, and what is your experience? And do you feel there are still some few ethical doctors together who can fight? I mean, usually IMA, you know how it is. Anyway, yeah.
I personally know only 2 doctors who provide medical termination of pregnancy without questioning the women or without questioning the dignity of women. Only 2 doctors in Kerala. Others are there, but they are scared to reveal their names because even gynecologists who say that that lady got cancer because she was providing or she was supportive of abortion. So such unscientific, and we can't even believe such things are going on among the faculties of medicine. And regarding the stand of medical practitioner, actually, I think all the organizations should come up with a women-friendly approach. That is their duty for the humankind. So that we should force them to do like that. And I think we can request the government of India or government of all states to have certain regulations statewide, so that all the problems what specifically a state is facing, that can be dealt with. Otherwise, this is going to be a big problem for women, especially women are getting educated and they know how to move on. But just because of pregnancy, they are chained up. So this should be changed. No doubt in that.
Yeah. Thanks, Dr. Veena. Now we would go to our next panelist. As you all know that Mexico recently decriminalized abortion. We have with us Dr. Gonzalez de Leon, is the chair of Women and she has been serving since 2013, Women and Health Together for Future, and she's also the co-editor of Women and Health Learning Package, which Judy had shown us. We have come with modules on various issues, and abortion is one of them. She's a medical doctor and holds master's degree in public health. She has been a part of academic staff of Department of Healthcare of UMax in Mexico City since 1981. She is currently the head of research unit on education and health, and her teaching and research career has been focused on health promotion and women's health issue, especially related to reproductive health. She teaches both in undergraduate and postgraduate programs and collaborates in institutional initiatives as well. And she has also served as external advisor to iPass Mexico, the NGO working on women's health issues. So over to you, Dayanira, to give us a glimpse of Mexico.
Dayanira, are you on mute?
Sorry. Well, congratulations, Bina, for the film, which is very illustrative about doctors' attitudes on abortion and many other issues on women. I'm gonna try to be brief in my presentation in order to have time for discussion. Well, the next, please. Okay, abortion laws in Mexico vary from one state to another because of the country's federal system. Can I have the next, Judy? Please. I think there's a problem with the...
Judy, can you make it slideshow?
Yeah, Judy,
You will have to
there
stop it, enable addition, and then enable editing. Probably we haven't done.
Okay.
It is on slideshow. I had it on slideshow. I will leave it here if you want.
Well, I was saying that abortion laws in Mexico vary from one state to another because of the country's federal system. There are 32 states in Mexico and only 4 have liberalized abortion laws. In the rest of the country, access to legal abortion continues highly restricted, even in cases of rape. And rape is a reason for abortion, a valid reason for abortion all over the country. Most abortions are performed under illegal conditions and many of them are unsafe. The incidence of abortion is high in Mexico and has increased over the last decades, especially among younger women, and estimates say that around 1 million abortions per year are occurring in Mexico. Most complications and deaths are among poor women, which makes abortion a matter of social justice and human rights. 70 women died after having an abortion in 2016, which means that 9% of all maternal deaths in the countries were caused by abortion complications. The next, please. The next slide, please, Judy.
It's on. It's on the next slide. I guess I can't put it on slideshow because then you don't see it. So.
Okay, there have been some changes in the laws since the year 2000 in Mexico. The first change was a bill to pass, to expand abortion legal grounds in the city. In 2007, abortion was legalized in Mexico City, which is the capital of the country, up to 12 weeks of gestation. More recently, in 2019, abortion was legalized in the state of Oaxaca, which is in the south of the country. And this year, there were more changes. Abortion was legalized in 2 more states, which are Hidalgo in June and Veracruz in July. Federal health authorities published a national technical guidelines to provide safe abortions throughout the country in preparation of a federal law about abortion. And the Supreme Court decriminalized abortion on September 7. So it's just weeks ago. The next, please. Okay, this Supreme Court ruling sets an important precedent to legalize abortion across the country under a federal legislation. And it challenges all state laws that mandate criminal penalties for women who have abortions. So any woman will be imprisoned anywhere in Mexico. The state authorities will be pushed to free all women who are currently in jail due to abortion-related crimes, and health practitioners will also be free because they are in jail because of the provision of abortions. The next, please.
Just a minute, because it will not take it the way it's supposed to be.
Okay,
I have to do it in 2 steps.
okay. But the former one, please. Okay. This Supreme Court ruling does not automatically make abortion legal across the country, and many challenges must be faced for the next years. Among these challenges are the need to create public free of charge abortion services in the 3 states that legalized abortion recently, Oaxaca, Hidalgo, and Veracruz, to change the penal codes that criminalize abortion in 20 states and approval of new abortion laws, to provide all first trimester abortions at the primary care level by well-trained providers and using methods currently endorsed by the WHO, which means that vacuum aspiration and medication abortion, to legally allow trained nurses to perform first trimester abortions, because only doctors are legally authorized, to guarantee access to legal safe abortion services and quality post-abortion care for all who needs them. To increase the gestational limit beyond 12 weeks of gestation, to legislate about who can object abortions, and it must be clear that individuals can object abortion, but institutions cannot. To remove all legal barriers that impede adolescents' access to safe abortion services, to increase efforts to incorporate abortion-related issues into medical and nursing curricula within universities, to educate and train health professionals in abortion-related issues at health services, and to fight against abortion stigma by influencing public opinion. And these are pictures of march in the streets. This was a march many years ago, but we are still having this kind of events in Mexico City. Well, that's all what I wanted to say in order to have time for discussion. Thank you. And let's make unsafe abortion history as the call for action this year.
Thank you, Dayanira. It looks like it's just the first step. We
Yes.
do have a lot of challenges in this.
Mhm.
So I would suggest that we go to our last speaker for the day, and then we could have an Q&A for both of them. So I would like to tell you about Dr. Jody Lewis. She is the chair of Women in Health Together for the Future and has been with us for more than 2 decades. She's also the co-editor of the Women in Health Learning Package. She is the public health sociologist who has been faculty of medicine in University of Connecticut Health Center for over 40 years. She is currently Professor Emeritus of Community Medicine and Pediatrics. She has developed many innovative elements of the medical and public health curricula, incorporating patient and community perspectives in clinical education, cross-cultural skills, and women and global health. She has served as the founding member of President of Global Health Education Consortium and the chair of APHA MCH Section International Health Committee and founding chair of Women, Children and Adolescent Task Force of the World Federation of Public Health Associations. Judy is the backbone of our organization, and we will be at loss without her. So over to Judy of regarding the restrictions in USA in various states. I mean, especially what Texas has done recently. Over to Judy.
Thank you, Kamini. That was quite an elaborate introduction. Let me get this set up. I hope I can just do this normally as a slideshow, but let's see if that will work. So I think it's very timely that we're having this discussion because I've been struck by a couple of things. One is that the Indian law was passed in 1971. Ours was passed in 1973. Dayanira's in 2021. And yet there are so many similar issues in terms of what's going on. I thought I would start out by simply giving an overview of what the current situation is. So about 18% of pregnancies end in abortion. Almost 1 million abortions were performed in 2017, but this was down 7%. And our abortion rate has actually been going down. It's actually lower now than it was the year that abortion became legal across the country. It is relatively common. About 1 in 4 women have had an abortion by the time they reach age 45. Half of the women are in their 20s. 60% have had at least 1 child. Half of them were using contraceptions, not exclusively, but mostly condoms or short-acting hormonal. And 75% were poor or low income. I think the other thing that's important to know is that 2/3 of abortions occur at 8 weeks of pregnancy or earlier, and almost 90% occur in the first 12 weeks. So that's important for some.
Judy, the slides are not moving.
So
can you put it on slideshow?
It was on the slideshow. This is the problem. If I put it on slideshow, you don't see the move.
Okay, let's just move the slides. Now we are able to see.
I know, but that's not the slideshow. And if I put it on slideshow, you won't be able to see. So
okay,
I don't know why that is, but anyway, these are some of the statistics I was just talking about. And these slides will be available. So so just a brief history in the United States, much like we have heard in Mexico, this has primarily been a state regulated issue. And prior to the late 1800s, there really weren't any laws against abortion. but abortions were not provided by healthcare providers, by physicians. And so in that period of time, MDs began to lobby against non-MD practitioners. By 1900, abortion was illegal in all of the states that existed at that point in time. Things began to change in the 1960s. In 1965, a Supreme Court decision held that the right of privacy within marriage predated the Constitution, and this made contraceptives available in places where it was illegal. And in 1967, a few states began to decriminalize and legalize abortion, but for very specific reasons, for rape, incest, and the health of the woman. Just prior to the Roe v. Wade ruling, abortion was still illegal in, I'm sorry, I'm trying to let people in at the same time, was still illegal in 30 states, and in some circumstances it was legal in 16, and then more generally in four states. A critical concept is the idea of viability. So when is the fetus viable outside the womb? And that was a key decision, that was the federal decision made in 1973 to legalize abortion. Though abortion has been legal at the national level, there are many barriers to getting an abortion, and that includes the cost, the distance, and limited availability. Limited availability is reflected in the fact that state legislators, so this was a federal decision, have enacted almost 1,500 restrictions since 1973. And this year has had the biggest number of them. There are actually 11 abortion bans that have been enacted, which cannot take place until they go through the courts, but it's a very dangerous time. And then there's this whole fetal heartbeat issue, which is basically the time you can start to hear electrical activity in the ultrasound of an embryo. So this is another big issue that's become a reason not to do abortions. This is just to give you an idea of what the situation would be if Roe versus Wade is overturned in the United States. And in this scenario, all of the bright red states are hostile states to abortion. And so if Roe v. Wade were overturned, almost 60% of women of reproductive age in the United States would be living in those states. So that's a pretty frightening thing to contemplate. So what's the future of abortion access in the United States? First of all, I have to tell you, I've been fighting this battle since before 1973. And I was actually a plaintiff in a suit in Connecticut to overturn the abortion laws in Connecticut in 1971. I can't believe that in 2021, we're still dealing with the same thing, only more so. So on December 1st, the US Supreme Court will determine not the Texas case, but a Mississippi case. And this will actually determine whether all of the prohibitions against pre-viability abortions are unconstitutional or not. And so if the Supreme Court says they are constitutional, that means that women in this country will no longer have access to abortion, dependent on the state they live in. The Texas state bill is one of those fetal heartbeat abortion bans, but the other issue is that it actually makes other citizens able to sue in court. And if I think my neighbor had an abortion, I can go to court, I can prosecute her. And if that is successful, if I demonstrate that she had an abortion after the 6 weeks, then I will be able to claim $10,000. So it's turning people into bounty hunters for women who have had abortions. And if this bill actually continues, so the Supreme Court didn't rule on it in September, or I guess it was actually in August, they didn't rule on it then because of a technicality, but it will come to the Supreme Court. And if it passed, if this is accepted, then 8 more states will do the same thing. So this is a pretty frightening time, especially because the Supreme Court is now divided with 6 conservative and 3 liberal judges. I just want to end with the fact that the cumulative effect of all of the state laws I talked about already is that they disproportionately harm Black, Indigenous, Latino, low income, rural, LGBTQ, young, and immigrants and those with disabilities. Because people with money have always been able to access abortions one way or the other, even when they were completely illegal. This is just to show you some of the recent demonstrations about what's been going on in this country in terms of fighting for women's rights to safe abortions. So I'm going to conclude with just saying that after almost 50 years of legalized abortion, it is now at risk in the United States, and an essential human right may no longer be available to the majority of American women. So the struggle continues, and we really do need to find ways to work together to make unsafe abortion history. Thank you.
Thank you, Judy, for this. And as you said, the struggle continues. I mean, I think just yesterday, one of the tiniest state in European Union, I'm forgetting the name, they had a referendum and a ban, which was like, I mean, they had a ban since 1930s, which was put off, again, with some conditions. But I do feel that we are progressing step by step. And I do see that we have a friend, Mahmouda from Bangladesh. Mahmouda, would you like to share with us the status of abortion in Bangladesh? There are students from Nigeria. Would anyone like to talk? Yeah, Mahmouda.
Hey, good evening.
Hey, how are you? Finally. Yeah.
I'm good to see you all.
Good, good. Yeah. So Mahmouda, what's the status in Bangladesh?
So I was listening to the present legal issues. You know, abortion is, I mean, okay, until the first trimester, menstruation regulation, as you know, MR, you know, so they call it, and that's happening everywhere. So abortion out loudly.
Your voice is cracking, Mahmouda. Voice is not very clear. Can you
hear? I mean, your voice is not clear either.
With noise. There's a lot of noise.
Hang on, just give me a second.
Okay, till the time Mahmouda fixes her technical glitch, I wonder if anybody has any question for Dainira and Judy as well, and would like to share in their respective countries what is the status of abortion.
Can you hear me?
Now? Yeah, I think with audio you could, yeah, you're there.
So I cannot tell you the legal status. I have to look into this, but abortion usually is not encouraged in Bangladesh, number one. Despite that fact, that is happening everywhere. I mean, of course, the private clinics is a space where people go and do the abort, but that is encouraged during the first trimester. Let me give you one example. Recently, I have faced a problem. One of my domestic help, actually, she was pregnant, okay, which I didn't know, and she didn't tell me. So someone actually told her that you look pregnant, and she said no, and I trusted that. That was my great mistake. So somehow she used some of the medicine or something. On 16th of September, she had a huge bleeding while she was at my home. And I suspected that that was, you know, and she told me I have my menstruation after 4 months. And I was quite surprised that why did you have that after 4 months, which means you were pregnant, you know. Anyway, so she didn't actually tell me the truth. And then the following week on Sunday, I sent her to a clinic to check what is happening, you know. So they diagnosed that it was an incomplete abortion. They didn't mention the time and everything, that the date. And then I couldn't actually enroll her in any hospital for the DNC because she didn't have any kind of relatives with her, you know. So I had to send her to a government hospital in nearby Dhaka, to where she has her. So the question is, the people in the private clinics, sometimes it is a question of whether you have your guardian's opinion to have it abortion, you know. So these are all kind of fishy and not very clear guidelines. However, all of the private clinics and government offices have the protocol that how you go for the abortion. But oftentimes the people are not aware, the lower quintile people, they actually go for a undetermined medication for induced abortion and everything. And that creates a lot of problem. I mean, the movie you were showing that said, "My body, my right." And I was really very impressed to see that, you know, that a girl can say that. I have hardly seen in Bangladesh, in the rural community, there are a number of cases like this where women are not aware and not actually raise their voice. I should stop here.
Yeah, thanks, Mahmuda. We do have Mercy with us. Mercy, are you able to hear? Because Mercy is from Nigeria. Would you like to share your experience, Mercy? I think she's having some audio trouble. Anybody else would like to share their experience or any opinion or comment on the presentations?
Everyone needs to unmute if they want to speak.
I know. You would have to unmute yourself to ask the question. Okay, everybody is muted.
Hello, good afternoon, people.
Yeah, good afternoon. Good afternoon. Yeah.
Good afternoon. My name is Adura and I'm calling from Nigeria. I happen to be a final year medical student of a teaching hospital, and I get to experience this almost every day because the teaching hospital has been turned to a dumping site for situations that got out of hand as regards conducting abortion in an unsterilized environment, because abortion is not legalized in Nigeria, except it threatens the life of the mother in quest. So most times when little people who had actually made a mistake run into the ends of or just seek medical advice or medical assistance, speaking to a doctor that they want to have this pregnancy terminated, usually in the first trimester and the early trimester, they are actually denied the right because abortion is not legalized in Nigeria, and this actually leads to them having unwanted pregnancy or seeking help elsewhere, because most times they are usually stigmatized. The stigma starts even from the medical sector itself. It starts from the nurses when they come to register, to seek help from the obstetrics and from their gynecologists. In the process of registering, the nurses are already saying, a young girl like you, what has happened to you? What happened to condoms? What happened to contraceptives and all? So even before getting to see the doctor, the girl is already having a second notion on what to do with herself and all. So most times these private centers would want to help them, and usually you all would agree with me that abortion is one of the leading causes of maternal mortality, and Nigeria happens to be the third nation worldwide representing as the third position worldwide, because when they actually seek help from these private medical centers, things get out of hand. Most times, these doctors are not even medical doctors. They are not certified. 1, 2, they are not experienced. 3, it could lead to over dilatation and over curettage due to overzealousness because they want to help the person, or they actually use they just concoct mixtures, herbal mixtures together, and before you know it, the lady finds herself bleeding excessively. And most times, due to the situation of Nigerians' weakened health structure, before coming to the hospitals, it's either the woman in quest dies, or she ends up having DIC because she has been disseminated intravascular clotting, because she has been bleeding for a while now, and then she's having consumption coagulopathy. Then she had to be transfused. What of septic abortions that would lead to sepsis, and from there to lead to death. So several things resulting from the sequelae of aborting in unsterilized centers due to denial of abortion rights from certified centers would as actually, and that's traced to the fact that abortion is not legalized in Nigeria. So there are several societies in Nigeria, like the Standing Committee on Sexual and Reproductive Rights, including HIV and AIDS, that's from the medical student arm, and there are other several organizations that are actually sensitizing and creating awareness, that are actually talking to the government to break the barrier and bring about a change, so that once a mistake is done, you don't have to question the root cause of the mistake. Rather, we have to do what? Find a solution to the problem. Thank you very much.
Yeah. Thank you for sharing. Judy, would you like to say anything?
I was just gonna say, it's in my experience, the countries that don't legalize abortion spend a lot of money on post-abortion care, huge amount of money on post-abortion care. And that's another lever we need to use in terms of policy changes, because the governments are still spending money. It's increasing maternal mortality, but the money goes for post-abortion care when women
Exactly. And the sequelae that results from aborting in centers that are not certified, that are not licensed, that are not qualified to actually conduct a proper abortion procedure.
Thank you very much, Mercy. Would you like to share anything? I think your audio, would you like to unmute yourself? Mercy, can you hear? Okay.
Well, Esther's on. Does Esther want to contribute?
Esther's here?
Esther's here, yeah.
Oh, I cannot see it. Hi, Hester, welcome. Would you like to say anything?
Esther?
I don't see.
It's Esther. It's Esther, not Hester.
Esther, okay.
But she seems not, I unmuted her, but okay.
Yeah. Esther, your audio is not working. You like to write on chat or something? If there is any question. Okay, I think there is this audio problem. I think we are coming to an end now to our program, and I would just like to inform everybody that Women in Health Together for Future have also proposed a statement, which is very much in the offing regarding making unsafe abortion history. And we would be joining the various forces in our whole journey, and in all saying that abortion is a woman's human right. Surekha, you would like to say something? Surekha, Dr. Sweta Taide is a program chair. Would you like to say something? A few words?
I think lots have been said, and I think what the thought process has started, at least our organization has come up with this idea of bringing us together from so many, so many countries. People have joined and we have expressed ourselves. So I think that's the start wherein we can, again, I would like to request, there are quite a few new people who have joined today in our webinar. So I would like to request all of you to visit our website, which is www.w24f.org, so that you can join our organization and we can work together for advocacy regarding women's health issues. And we have our Women and Health Learning Package, where we have provided resources for many other women health issues. One of them is abortion, then violence against women has been the theme of our organization 2021, and we also would be working on other issues. So please join our organization, visit our website, and we continue our dialogue so that we can make women's health issues come to the front regarding policies and processes, so that we can work together. Thank you.
Thank you. Thank you, everybody, for participating in the webinar, and all those who have participated would be also getting a participation certificate. And I have mentioned in chat, besides our website, it is very important, all of you students, to follow us on social media. We are active on Instagram, Twitter, and Facebook, and it is very important to reach out everywhere. And we would really like students to join our organization, because we feel students who are the future. Everywhere. It's a very strong, the student networks are very strong condition to take forward women's health rights, especially reproductive rights and violence against women ahead. I would request Judy that to play a song which I shared, a pro-choice song for ending our webinar, which I hope you will all enjoy.
I'm working on it.
Yeah, sure. And please keep a lookout on our website. We will be having regular events. We are beginning. Each month we are proposing to have at least one event.
Still ruling the country today, and I don't really feel like they have the right to take more than they already have from us away. This ain't about that, or has it really been all along? No, this ain't about that. If you want to focus on right and wrong, shouldn't schools have better sexual education or contraception information for once? Only 24 states require sex ed, so more than half of US teens need a condom. The problem's abortion. Focus on what's going on, it isn't abortion. If you want to focus on right and wrong, this is my body, this is my choice, a painful decision, but you aren't gonna steal my voice. It isn't just morals, and it's not black and white. We will govern our bodies, it's our legal right. Let's make the fight. Did you know that many think the morning after pill is an atrocity that should be banned? Maybe men should get vasectomies and get them reversed once they find a woman who'll take their hands. This ain't about that. This is all about what's legally life, what's an issue of law is turning into one of moral strife. Life is an equivalent based on definition. You must account for experience. And remember that a fetus requires another body to give them their sustenance. The courts can't force us to donate organs or blood of our own. This is no exception. We can face our repercussions alone. This is my body. This is my choice. A painful decision. But you aren't gonna steal my voice. It isn't just morals, and it's not black and white. This is my body, and it's my legal right. Listen. Doctors will be scared of making any incision, which means they won't be acting on their best medical decision. Should they just make an attempt, which is not defined, they face 99 years of prison down the line. And yet let's say they don't perform because they're scared of spending time. Say the patient gets sick and sues the doctor for their crime. This all affects the healthcare system for you and me, facing higher doctors' bills to balance liability. And everybody's terrified and everybody's ill. Meanwhile, thousands could use help just getting themselves on the pill. There are way too many babies and the population's growing. We're running out of water and the rate of death is slowing. Adoptions are hard, the foster system's saturated, but an 11-year-old's birth just because she's impregnated by an uncle or rando who held her down and raped her. She was too afraid to tell, and it didn't show till 3 months later. And now she has the blessing to ruin her life and her physique, while to carry on the genes of men who violate the weak. I don't think so. For every woman who's ever had to get on her knees, stand up. For every woman who's ever had to say please, stand up. Stand up. This is my body. This is my choice. A painful decision. You aren't gonna steal my voice. It isn't just morals, and it's not black and white. This is our bodies, and there are legal rights. Let's make the fight. Oh, let's make the fight. Let's make the fight.
Unmute, Kamini.
I said, what a rocking way to end our webinar in making unsafe abortion a history. Thank you, everybody. As said again and again, please follow us on social media, on our website, and we would be having at least another event every month. So be in touch and do get involved. Yes.
Thank
Great and
you
meaningful
very much,
conversation.
Kamini. Thank you.
Thank you,
Thank you
Kamini.
all for making it happen at a very short notice. I would like to thank Dr. Surekha, Judy, Dainera. I mean, it is just within 3 days we managed to get this webinar, and thank you very much. All of you.
And thank you for organizing.
Thank you. Thank you.
Thank you, everybody.
Thank you, everybody.
Thank you.
Thank you. We would
See you soon.
Yeah.
Bye.